Hello everyone, and I welcome you to this lesson where we are looking at restraining of psychiatry patients. To restrain, to give some kind of restriction to a psychiatry patient. Alright, so that is our topic for today. Of course, I've divided my lesson into three. So I'm talking about this topic, alright, so that we can understand. Okay, so restraining of patients can be done in a psychiatry emergency. Okay, restraining of a patient can be done in a psychiatry emergency. And maybe I've tried to define psychiatry emergency as an acute disturbance in behavior, okay, thought or mood, which if untreated may lead to harm either to self or others within the environment, or disruption, major disruption within the environment. So that is what we call a psychiatry emergency. So now you can imagine a patient has a problem with BTM. Okay, so now psychiatry emergencies mostly involve behavior, okay, acute changes in either behavior, okay, thought process or mood. So there's that acute something which is happening suddenly and then it's happening fast. Okay, so when there's that, it composes psychiatry emergency. And a lot of students find it challenging to say, when you're talking of an emergency in mental health, does ABC apply? Yes, ABC applies, okay? Because you have to look at the nature of the psychiatry emergency that has come. Alright, so just at the corner here, I tried to put in some cases that may come as psychiatry emergencies. So we can have parasuicide, which can come as a psychiatry emergency. We can have substance abuse or substance dependence, patients who rapidly have problems with BTM, behavior, thought process or mood, which are the three most component elements that are important in psychiatry emergency. So we are saying parasuicide, substance abuse or dependence. These may constitute psychiatry emergency. It's very important you establish the psychiatry emergencies that are there, so that when you want now to talk about it, because when you talk about emergency, you literally refer to airway, breathing and circulation. So now, what are you going to do? Is it just airway, breathing and circulation? No. There is also the aspect that may come to do with the restraint of a patient with a psychiatric condition. So alcohol intoxication, in this instance, patients may come unconscious, suddenly just becomes unconscious. So the issue of airway will come in. Patient may even start fitting, okay? So the issue of airway comes in, okay? Breathing and the issue of circulation, so they come in. So even when they're talking about mental health emergencies, the issue of airway, breathing and circulation can still come in. Okay, but it's also important to understand the whole clinical picture so that you can now apply your skills nicely. Okay, acute depression, okay, constitutes a psychiatric emergency. Someone just all of a sudden they become depressed. Okay, sometimes because of losses or they just become acutely depressed. So that constitutes a psychiatric emergency. Okay, then if there is presence of delusion, that can also constitute a psychiatric emergency, because you don't know necessarily the thought process of the patient. Okay, it is violent in nature. Of course, patients who are violent, that constitute a psychiatric emergency, because they pose a danger either to self or others or to the environment. Okay, then patients that come with panic attacks, also that constitutes a psychiatric emergency. And lastly is any sudden rapid change in behavior. That also constitutes a psychiatric emergency. So with these constituents of psychiatric emergency, then it is now it becomes now easier to know which conditions now fall within this constituents, so that we can now say this mental health condition falls under psychiatric emergency. Okay, looking at those constituents. Otherwise, whenever you have a psychiatric emergency, there are some underlying conditions, okay, in the patient's behavior. So certain things that you can see. The other thing is that patient may be behaving as if they are in pain. Okay, they are somehow distressed. So these underlying conditions you have to analyze. Is the patient in pain, okay, or is just a mental health kind of behavior that is being portrayed? So you have to rule out some underlying conditions like pain. Okay, then there can also be issue of anxiety. Okay, the issue of anxiety is extreme, is feeling of fear. Okay, of pending loss or something like that. So the issue of anxiety, look at the patient. Is the patient anxious? Okay, what is making the patient anxious? So it's important you establish that so that you can remove those things that are making the patient anxious. The issue of fear of either potential danger or imminent danger. Okay, so fear is a feeling of distress, okay, of either a pending potential danger or an actual danger that may be within the patient's vicinity. So you have to look at the issue of fear. All right. You can also rule out the issue of depression. Okay. It's a patient in acute depression. Of course, you take history and you try to take all this information in order to establish that. Then the potential risks to self or others. Okay, so when you're looking at the patient who has come within your psychiatry department or your psychiatry ward there, all right, you also need to look, do they have the potential risks to self or others? If they come exhibiting this potential risk to self or others or the environment, then that would constitute a psychiatric emergency. All right, so when you're talking about restraining of patients, okay, in psychiatry, there are certain things that I put in that you need to note. That when you are applying this scheme, you have to follow the ethical rights. Okay, the ethical rights that you have to be ethical in the way you apply this, because this is a last resort. So, look, rights should be respected. You should not infringe on the patient's right. Okay? Then, not for coercion. You don't restrain a patient just because you want to win favor or something like that. Okay? Or you want to win patient's trust. No, it should not be done for that. So, restraining of psychiatric patients should not be done for coercion purpose, and then should not be done for punishment. Okay, legal issues may come in if you do it for punishment or you do it for disciplining the patient. Okay, it should not be done for that, and also it should not be done for self-convenience. Okay, just because you want to carry on certain procedures so you feel it convenient to restrain the patient. No, it should not be done for self-convenience. Alright, so now let's look at approaches or categories, okay, that you might use in nursing a patient who might be violent or who may come with a psychiatric emergency. A patient with problem with, let's say, panic attack, alright, patient in acute depression, or patient who has the potential risk to harm him or herself. Alright, so now, most restraining of patients, I said, you may find using it in psychiatric emergency. So that is where you might find it, and it is the last resort. So now, what would be the approach or the categories that you may follow to nurse such a patient? So here, the categories I would just literally give you 3 categories, but I'll try to broaden that. I can just give you 3 categories in that there should be physical restraint, there should be chemical restraint, or there can be seclusion. these three main elements may help in restraining the patient. Okay, but we have acquired a lot of skills, because to be a mental health nurse does not mean you need to have a black belt so that you can restrain your patient properly. You even put them in handcuffs and the likes. No, it should not be like that. We have had a lot of skills that we have learned. So you need to have negotiating skills. Okay, you need to try to negotiate with the patient so that you reach to some kind of agreement and you win patient's trust. Okay, then within the patient's environment, you need to remove those distractors, those things that are distracting the patient, those things that are provoking the patient. So remove the distraction. You will see that the patient is going to calm down. The main aim of restraining is to help the patient to calm down. So what is it that is stressing them that we need to remove? So remove the distraction that is causing them to become violent. Okay, negotiating skills, win these patients so that you have to win them to be on your side so that you can now gain cooperation with the patient. Then physical restraint. On physical restraint here, we are saying, please, here I'm discouraging no use of handcuffs. Sometimes you can just use some clothes or some kind of a belt to restrain the patient within the bed. This is to prevent the patient from using their body to harm another part of their body. So you can put them within a bed. This bed should be padded so that the patient doesn't end up having injury. So we are saying it should not be used for punishment or discipline. Okay, so you don't use restraint for fun and start using it for punishment or disciplining the patient. And also it should not be used for convenience. Okay, because you want to do other procedures, then you feel it necessary to just restrain the patient. You may provoke patient's emotions, and then the condition for that patient will not improve. Actually, it will just be worsening. So don't do it for convenience. Here you need to do very good assessment. So now, what is the approach that you use? Okay, what approach can you use in order to restrain or help the patient to calm down? Patient who was calm. Manic patients, they can be violent. Okay, so we can have a lot of patients that can be violent. So when they calm, okay, posing a danger to self or others, it will be treated as a psychiatry emergency. And I said, whenever we're talking about psychiatry emergency, A, B, C also may apply. Resuscitation. Because if someone comes with alcohol intoxication, you may need to resuscitate this patient. Okay? Alright, so you may need to resuscitate, and to resuscitate here, that's mean you may need to detoxify the patient from the drug that they might have abused. You may need to start detoxifying the patient. Alright, so what is the approach, or what are some of the categories that you can use for restraining the patient? So I said the three main categories that you can use is physical restraint, chemical restraint, or you may use seclusion. But other aspects can come in. That is negotiating skills. So negotiating skills just has to do with how well you communicate with the patient. Okay? How well you communicate with the patient so that you win the patient's trust. So you need to use your negotiating skills. And then in the patient's environment, you have to remove those things that are distracting the patient, those things that are provoking the patient to behave in a certain way that necessitates the condition to be termed a psychiatry emergency. And we also define the psychiatry emergency, okay, as an acute disturbance in behavior, thought, or mood. So an acute disturbance in three elements: behavior, thought, or mood. Okay? Or mood that if not resolved, if left without any resolution, then the patient may cause harm to self or may cause harm to others. So that is a framework in which you need to look at when you are talking about psychiatric emergence. Okay, there's a problem with behavior, there's a problem with thought process, there's a problem with mood. But even A, B, C may come and play depending on how the patient has come to the world. Alright, so thank you very much. For more videos, I'm encouraging you to subscribe and click on that bell icon so that each time we post some lessons, you are able to see our lessons. I encourage you to comment and put some topics that you would want us to see, that you would want us to cover. So you can just post those lessons so that we can cover them in our next lesson. So we are going to cover a lot of things within this lesson, and all the lessons are going to be medical related. Okay, they're going to be medical related. So our aim is to help simplify the work of a medical student, or our aim is to help you within your continuous professional development so that you refresh your knowledge. Okay, so thank you very much for listening. We are looking at restraint of the patient. Okay, restraint of the patient, and I've emphasized that it can be used in a psychiatric emergence and it should be the last resort. It can be used necessarily to protect the patient, okay, and also protect the patient, to protect the patient or to protect others from the patient. So it should be a last resort. It's not something that is done almost each and every time. It's important you follow this approach, okay? When you follow this approach in restraining the patient, then you have no legal implications that may follow you. So thank you very much.